My name's Gavin Lindberg. I live in Germantown, Maryland. The title I'm most proud of is Evan's dad, and I'm also the co-founder and president of the Evan Foundation, which is an organization that my wife and I established in memory of our son. So my first message would be hopeful. Hope and optimism are contagious within a family, and I think that's incredibly important. I know it's incredibly important. And as devastating as high-risk neuroblastoma diagnosis is today, I think it's, helpful perhaps to recognize that it doesn't necessarily have to be as devastating as it was almost 20 years ago now for our family. There are new treatments that are available. There are promising new therapies in the pipeline. We have an incredibly talented group of neuroblastoma investigators doing remarkable work in the lab, striving to develop new therapies for these kids. So that would be my first message. My second message is immediately become your child's advocate. Speak with as many experts in the field as you can, both clinical folks and research folks. It's unfortunate, but it's true. Mom and dad, they really have to familiarize themselves with this terrible disease as quickly as they can to ensure their child gets the best treatment. And, you go from a circumstance, and I think this is true for almost every family, you go from a circumstance where literally 1 minute you do not know, you have never heard the word neuroblastoma. You don't know how to spell it, you don't know what it is, and then you're being told that your child has it. And it is just one of the most challenging and devastating diagnosis that a family can get. And immediately, mom and dad have to become an expert. But the good news here is that both the neuroblastoma clinical community and the research community are full of amazing people, as I mentioned, and they're very open to speaking with newly diagnosed families. They want to be helpful, they want to take that phone call. And parents, as difficult as it is overcoming the shock of getting a diagnosis, if you're not being given them, you've got to ask for information about experts in the field, and you've got to pick up the phone and you've got to introduce yourself and you've got to have those conversations. That would be my other word of advice. Well, I'll start by saying, fortunately, we had a diagnosing oncologist who described the various treatment options that we could pursue. We were provided with names of experts and phone numbers to contact to have some follow-up conversations, if we wanted to do that. And I did want to do that, and I did do that. And again, I will emphasize the importance of doing that to anybody. I think it's critical. And that allowed us to make an informed decision from the start. And I felt, and I still feel this way, very fortunate that that occurred, because I understand that that does not happen with every new diagnosis. So again, my message would be, if you're not receiving that information, to ask for it. And I would go so far as to say, if you were being treated by someone at that diagnosis phase who's reluctant to give you information on other providers, other experts to call, then perhaps you may be in the wrong place. Because I think it's important with such a devastating disease that parents are able to communicate with as many experts as possible. And then, of course, there are resources that are available as well online that are, through centers of excellence that care for patients with neuroblastoma, through patient-driven organizations who have excellent peer-reviewed resources specifically for parents. There's an organization called CNCF, the Children's Neuroblastoma Cancer Foundation, that has a parent handbook, which is an excellent resource for parents, including the newly diagnosed. So there's other avenues as well to gather as much information. And you can never have too much information. And I would encourage people to stay in this mindset of striving to educate yourself as much as you can, as often as you can throughout the whole treatment journey. It's critical to do that. You absolutely have to prepare yourself, as difficult as it might be, for what might come next. So you're in a certain phase of treatment, at a certain point in time, and you hope that goes well, and you hope there's no relapse, or there's no refractory disease, or there's no bumps in the road. But you need to be realistic, and you need to understand that, hey, There's a chance that that could happen, and I need to be prepared as mom and dad to take the next step. Because when it does happen, you don't have a lot of time to make key decisions. So the more educated you are as a parent, the more empowered you are to make the best decision for your child. If we're talking about what do I wish I would have known, right? One of the first things that comes to mind is the toxicity of the treatments that my son was enduring and the long-term impact of those toxicities had he survived. I say that, but the sad reality is you as a parent don't have the luxury of rejecting a therapy because of its toxicity. You're fighting for today and you're really deferring decisions about tomorrow because you have no choice. And that's a heartbreaking place for a parent to be in. I do think understanding what the reality is of any given therapy, not only for today, 6 months from now, but 6 years from now, hopefully 60 years from now, right, is going to have on a child is helpful. I don't think it can help necessarily guide yes or no decisions on treatment because you're forced, in most instances to have to expose your child to these awful toxicities. But understanding them, I guess, is my point, is I think important to the extent that that's possible. I would turn the question around a little bit and say, what would I, as a parent, like the world to know about the high risk neuroblastoma patient experience? And the way that I would answer that question is, what young children, young kids like my son are forced to endure really verges on being medically and morally unacceptable. That's how toxic this regimen is. And everybody shares this view. You talk to treating clinicians in the neuroblastoma space, and they will tell you all day long they hate what they have to do to our kids to get them hopefully to a place where they're cured. And you often hear the phrase, cure is not enough. And I love that phrase. So that's a mantra that you hear in the neuroblastoma research and clinical community. Like what we have to do to these kids to get them to a place where they survive, if they're fortunate enough to be a survivor, is unacceptable. The toxicities are unacceptable. And we really have to do better by these kids as a society. I think one experience is nobody is ever going to understand what you're going through as a parent, unless you're talking to another parent, right, with a child with neuroblastoma. But it's impossible to understand what moms and dads go through in this circumstance. And that's difficult because you find yourself in a place where you're almost in an alternate universe in this neuroblastoma world, and then there's reality over here, right? And navigating those two worlds is so hard because nobody understands it unless you're in it. I don't know that I've got a lot of good advice on that. I think you got to hold your close friends close and hope that your close friends hold you close. But that's another piece of this that I think, bears recognition and understanding. Maybe for the community of folks out there who are friends with neuroblastoma parents, keep that in mind. It's unimaginable what parents go through. And, as a friend, you're not going to have all the answers all the time. But I can tell you that when you are supportive and empathetic and curious about what's happening with a child, that's very, very greatly appreciated every single time.